So if you go to the doctor and they tell you you have a concussion, they might have ordered imaging or something like that. Most likely though, the treatment they're gonna recommend is rest. So making sure you're getting enough sleep, making sure you're even taking naps during the day, and rest in terms of limiting the amount of visual input that the brain is having to process. So that means things like very limited screen time, putting the phone away, putting the television away, those types of things, because the brain needs time to heal completely, and only rest like that is going to actually allow it to do so. Most symptoms are going to resolve within a couple of weeks. Some people might take a little bit longer depending on the severity, but some people actually develop what's called post-concussion syndrome, where the symptoms continue to linger even months, sometimes even years after the injury, and that can become an incredibly frustrating process for people. It's hard for them to accept that they might have limitations that they didn't have before that go on for a long time. So that's where a mental health therapist would come into play, because while we don't initially treat like the brain damage itself, what we can do is help people learn to accept the limitation and decrease their feelings of frustration about it, learn to work within their new limitations and capacity. CBT is helpful for that, cognitive behavior therapy, so that treats some of the negative thinking about it, like I'm never going to get better, this is all my fault, those types of thoughts that are going to cause a person to have a lot of anxiety. Sometimes people get super fixated on the symptoms themselves, and therapy can also be helpful for helping them to reduce some of that and be able to go back to focusing more on the other things in their life. The other thing that works that's helpful is somatic experiencing, which helps the overall nervous system feel more regulated. So while the brain is healing and the person's dealing with some of the limitations, they can also continue to feel unsettled, agitated, and somatic experiencing can help us work through some of those emotions and help the body start to feel safe again. So sometimes when there's an injury, people feel like their body itself has kind of become an unsafe place. And therapy is helpful in helping them learn that the body is going to heal. It's going to be okay. I'm going to be okay. I just need time. I need to give myself time and patience to have that. One more thing that's helpful is co-regulating touch, which is where the therapist uses their own nervous system, more regulated nervous system than the client's. And with just gentle supportive touch, allows the client system to borrow that calm regulation from the therapist. And that helps settle the overall nervous system. And it can also increase a sense of self-compassion. Yeah, co-regulating touch can be done with the person seated. It can be done on a table. Sometimes their therapist is going to be putting their hand right on the brain itself. Sometimes they're just going to be putting their hand somewhere that helps the person feel like they're being supported. Sometimes we support the kidneys, just gentle touch on the shoulder, sometimes the joints. The body then kind of takes in that support and integrates that into its own system and starts to feel better overall.
Yes.